So my name is Keri Iyall Smith. I'm a sociologist, and I study Indigenous peoples and human rights. Within human rights, I tend to like to focus on what's going on in the US, but I do also think about the international issues that relate to Indigenous peoples as well. Native American or Indigenous communities in the US prior to COVID-19 were highly under-resourced with their what's called the Indian Health Services. Indian Health Services serves both reservation communities as well as urban Indigenous populations in the US. And Indian Health Services is chronically underfunded. So prior to COVID-19, we had huge issues with that agency being adequately funded and therefore being able to provide adequate health care for Indigenous people. Now, as we're starting to see some of the hot spots popping up on reservations, the lack of resources is a bigger concern. So we still have that lack of adequate staffing. Now, on top of that, we're adding a lack of PPE, lack of testing materials, and not sufficient medical providers there. So that's been causing big problems. Also, the Navajo Reservation right now is a hot spot. On the Navajo Reservation, 40% of homes do not have running water. So one of the first things that we're told with this pandemic is to make sure that we wash our hands adequately. If you're in a home that doesn't have running water, you can't wash your hands. And not as frequently as we all are now, especially. These folks have to go and travel to get water and bring it into their homes. So they try to minimize their water use, but now are being asked to wash their hands. Many of those homes also do not have electricity. So those are probably the two biggest areas: the lack of resources and support for Indian Health Services. Also, many homes lacking adequate running water and electricity. In urban populations, we're also really worried about Indigenous peoples becoming erased from statistics, which already it's very hard for you to get access to data on who's getting sick and who's dying from COVID-19. So urban Indian populations are now being clumped into the other category, which doesn't give us a lot of good information about their experiences. Those people are also going to be disproportionately, we have high rates of unemployment and high rates of diabetes, hypertension. Those are two of the biggies that we see as the pre-existing conditions that seem to exacerbate COVID-19, and those are existing at really high numbers in Indigenous Americans. They've had trouble accessing the funding that's come from the CARES Act on reservations as well. There was a lawsuit about that, but that had been stopped for about a week as well. So that was something unique impacting them too. But we're seeing a lot of urban Native folks who are making the explicit choice not to go home because they don't want to bring the virus from the urban areas and transmit it out to the reservation, where we know in general in the rural US, it's harder to access adequate health care. So people are making that really intentional choice to stay away from home, even though it might be a time when you want to be close to family, to support them. Some reservation communities are actually also closing off their borders to folks from outside. Being sovereign nations, they're able to prohibit people to come onto the reservation who are outsiders. So in that way, that can be a way for them to protect themselves.